In a study with around 400 hospitals, there was actually some pretty concerning results with racial disparities. Now, a Black person's treatment might be older and cheaper in comparisons to a white person's treatment, which might have been newer. A Black person may be less likely for a coronary bypass, which means a less chance of survival. And they would also be discharged earlier, at times when discharge will not and should not be appropriate. Now, specifically focusing on Black women, they're less likely than a white woman to receive radiation therapy in conjunction with a mastectomy. In fact, they're just less likely to receive a mastectomy at all. That's exactly what I'll be exploring in today's presentation, intersectionality between race and gender in the healthcare industry today. But before we get started, I want to do a quick introduction. My name is Aarushi Bute. I am a rising junior at Marquette High School, which is located in Chesterfield, Missouri. I am the associate editor-in-chief of my high school's newspaper, Marquette Messenger, and I'm also the founder and editor-in-chief of my own publication called RSD Lives, which is basically a platform for my district's students to just have a platform to talk about themselves and to tell their own stories. And I'm also pretty well involved in other clubs like Speech and Debate, HOSA, Red Cross, and just a number of other ones. But specifically focusing on my gender-based research, I've done 2 semester-long research projects, one being the lack of girls' education in India, and the other being the need for intersectionality in feminism and modern-day feminism. I've done around 62 hours of research, written about 10 research papers, and did numerous research presentations, one being a capstone, which is about 20 minutes long, and I did present to a panel of judges. I'm also pretty well involved in a number of gender-based nonprofits, one being to really just talk about the gender-based and the gender research gaps in gender and sex, and just taking that gender and sex lens throughout all research. So without further ado, let's get started and talk about what I'll be talking about in today's presentation. I'll be talking about backgrounds, clinical trials, implicit bias, tools and machines with this one-size-fits-all system, and call to action, how you specifically can help. So let's start off with some background and some basic definitions of what intersectionality actually is. So intersectionality, this term, was coined by UCLA law professor and a Columbia law professor known as Kimberly Crenshaw. And she coined this term after looking at a case, and she asked herself this question: is there race discrimination or is there gender discrimination? And the answer was, there was actually both. There was both gender and race discrimination formed together to create this unique form of oppression. It's basically 2 intersections, hence the name intersectionality, combining together to form the specific distinct oppression. So it can be race or gender, but it could also be socioeconomic status, age, it could be sexuality, all these different types and sectors of discrimination. Now, let's talk more into the healthcare industry and kind of what's going on right now, specifically with clinical trials and the lack of diversity in them. So a good example would be a drug trying to treat multiple myeloma. And this is actually a disease that 20% of Black Americans suffer from. But in this clinical trial, less than 2% studied were actually Black. I want you to back up for a second. Less than 2% studied were Black. Now, when you have this lack of diversity, that means you're actually not getting the accurate results because, again, diseases, drugs, they all affect each person individually, specifically with different ethnic groups and different genders. Now, we've actually seen this spark increase of minority participation when it comes to unconsented clinical trials. And a good example of this would be this woman, and I'm sure you guys have heard about her. Her name is Henrietta Lacks, and her cells were used without her consent for decades now. And this is actually quite common for a lot of clinical trials. There's a huge minority participant increase in unconsented clinical trials, but a huge diversity gap with consent and with clinical trials that will actually benefit the participants. Again, as the well business going says, you can't manage what you can't measure. If we don't properly measure what's going on, if we don't properly have these inclusions and intersectionalities of different ethnic groups, different genders, we won't be accurately able to measure what's going on and what occurs in all these different types of bodies, because again, each body responds very differently to each drug. Let's talk about the implicit bias, which is basically just a subconscious bias in a physician. Now, when this IAT, which is the Implicit Association Test, was administered to physicians all across the nation, these were the results. They associated white faces with more pleasant words and associated Black faces with less pleasant words. Now, when you have this implicit bias, it's why there's this big gender gap, this big racial gap in the treatment that's offered. It's why numbers like this exist. It's more likely that Black mothers, it's 243% more likely that Black mothers die from pregnancy-related complications than white women. This isn't just far from it. There's so many other statistics that say around the same things. There's this huge gender gap. There's this huge race gap. This huge, just women of color are facing the consequences of no racial inclusion and no intersectionality in the healthcare industry today. There's also this one-size-fits-all machine that fits with tools and machines, and also, like I mentioned before, the clinical trials. Again, everybody responds differently to different ideas, different drugs. So when you really look at it, only 29% of women reported using equipment specifically designed for women, which means the healthcare industry right now is this one-size-fits-all kind of system, which obviously and evidently isn't true. We need different research, we need different lenses, we need different equipment when you take this into consideration. And when this is different types of equipment, it's often change the color to pink and increase the price. This isn't just seen in medical equipment, it's also seen in general equipment. Like razors is something I know I have faced where they just change the color to pink and increase the price to make it more womanly. Now, there's also genetic disorders and conditions that we also need to take into consideration with how the healthcare industry is handling them. Specific disorders are mainly common around specific gender and specific ethnic groups. For example, sickle cell disease is quite common in the Black population, but not so common in the white population. There's specific gender disorders, and we need to take into consideration. There's also different symptoms and diseases, like I mentioned before, how everyone responds differently. And this is a kind of comparison between a Black female and a white male, and you can see they both have the same condition, a stroke, but they both have different symptoms. The Black female has fainting, hallucinations. The white male has loss of speech and balance. So again, they have different symptoms, different conditions, same condition, but different symptoms, which is why we need more inclusion. We need more intersectionality in everything in our research, what we're working with to really get these accurate results and to benefit everyone, including these minority groups, including women of color. Now, the call to action, my favorite part, and how you specifically as future global health leaders can help. Well, it's all of it is based on your actions. The future is based on your actions. Now, just be aware of this implicit bias. Again, implicit bias is subconscious. You might not even know you have it, but be aware of it. Notify your friends, your coworkers about this implicit bias. And as you go into your future jobs, again, be aware of the research you have and the healthcare and treatments you give to others. It kind of coincides with the trials and research. So over the past few days, I've seen that a lot of you actually go and lead your own research. So take this and use this gender and race lens to really focus on that research. Have this inclusion, have the intersectionality, because again, it truly is needed to get those accurate results. And finally, exert pressure, whether that be on your mentors or your government, to really fund and lead projects that, again, focus on inclusion and intersectionality. Let's do a quick overview on what we talked about today. So with clinical trials and tools and machines, it's kind of with this one-size-fits-all machine, which couldn't be farther from the truth. It actually should not be a one-size-fits-all machine. It should actually be a system where there's different categories, and we should be functioning and researching through a gender and sex lens research. Also, there's this implicit bias with physicians that we've been seeing that contributes to a lot in how there's unequal treatments and disparities in these treatments. And the call to action, as you are the future, as you are the global health leaders of the future, it is up to you to take these next steps to really make an accurate and an amazing future for all these ethnic groups, including women of color. And these are a few of my references, and I did want to make a few acknowledgements. First, to my mentor, Miss Williams, thank you so much for leading me through this whole process. It's been a really long process, but thank you so much for giving me the time to go through this whole 1-year-long research. Thank you to the Global Health Leaders Conference for giving me this amazing opportunity. And thank you to the audience for listening, and hopefully you took at least one piece of advice home with you today. Again, thank you guys so much. If you have any questions, you can go ahead and shoot me an email at abate9@gmail.com, or you can follow me and DM me on my Instagram at Aarushi Bute.